Hormonal birth control has long been celebrated for empowering women with reproductive control and freedom. From pills to patches, these contraceptives have become nearly ubiquitous, promising not just pregnancy prevention, but also benefits like regulated menstrual cycles and clearer skin. However, the dark side of synthetic estrogen, a key ingredient in many contraceptives, has begun to surface, revealing increased risks of strokes, blood clots, and even long-term thyroid issues. These hidden dangers affecting women at younger ages have sparked urgent questions about how much we really know and what we're not being told about the impact of these hormones on women's health. Stroke, once considered a condition of the elderly, is now increasingly affecting younger women, including those under 35. Research from the Centers for Disease Control and Prevention, CDC, shows a worrying rise in stroke rates among this demographic. One of the key factors? Synthetic estrogen, found in many forms of hormonal contraception. Estrogen's role in altering blood clotting mechanisms is well documented. It promotes the liver's production of clotting factors that increase the likelihood of developing blood clots, a direct precursor to strokes. A study published in the journal Stroke found that women using oral contraceptives have an elevated risk of ischemic stroke, the most common type, which occurs when a blood clot blocks a vessel supplying blood to the brain. The risk was notably higher among women who had additional risk factors such as smoking, hypertension, obesity, or a history of migraines. In fact, the study showed that oral contraceptive users had about 1.9 times the risk of stroke compared to non-users. This statistic is especially concerning given the widespread use of birth control among young women, often starting in their teenage years. The impact of estrogen on blood clotting is not trivial. Birth control pills, even those marketed as low-dose, still pose significant risks, particularly when combined with other lifestyle factors. Women deserve to know that their risk of a stroke, even at a young age, could be influenced by hormonal contraceptives. The connection between hormonal birth control and blood clotting disorders is well established, but often downplayed in discussions about contraceptive options. Synthetic estrogen increases the levels of certain proteins in the liver that promote blood clotting. While this mechanism is crucial for preventing excessive bleeding, it also increases the risk of clots forming in veins or arteries, potentially leading to deep vein thrombosis, DVT, pulmonary embolism, or stroke. For decades, researchers have warned of this risk, but recent trends suggest that the message still isn't reaching many young women. The risk is particularly heightened in those who smoke, have a family history of clotting disorders, or are overweight. Alarmingly, many young women are prescribed birth control without a thorough assessment of these risk factors. The risk is not evenly distributed across all forms of birth control. Some carry a higher risk than others. For example, contraceptive patches and vaginal rings, which deliver higher doses of estrogen directly into the bloodstream, have been associated with a greater incidence of blood clots compared to pills. Yet, the FDA-approved labels for these products often bury these risks deep within their literature, overshadowed by marketing that emphasizes convenience and effectiveness. Beyond the immediate risks of strokes and blood clots, synthetic estrogen can also impact the thyroid, a small but powerful gland responsible for regulating metabolism, energy levels, and overall hormonal balance. The thyroid's delicate function can be disrupted by the hormonal shifts caused by prolonged exposure to synthetic estrogen, potentially leading to conditions such as hypothyroidism, hyperthyroidism, and thyroid nodules. While direct links between birth control and thyroid cancer remain under investigation, there is growing concern that hormonal imbalances play a role in thyroid health problems that may not manifest until years after discontinuing the pill. The mechanism is complex. Synthetic estrogen increases the level of thyroxine-binding globulin, TBG, a protein that binds thyroid hormones in the bloodstream, effectively reducing the amount of active hormone available to the body. This subtle change can have cascading effects, leading to symptoms that are often misdiagnosed or attributed to other causes, such as fatigue, weight gain, or depression. Personal stories like yours illustrate the hidden costs of hormonal birth control. After stopping birth control, many women experience symptoms of thyroid dysfunction that may go undiagnosed for years. Some, like yourself, may discover precancerous changes that require surgical intervention, leading to lifelong medical management and daily medication. The psychological and physical toll of these long-term consequences is significant. Yet the connection between synthetic hormones and thyroid health is seldom discussed during contraceptive consultations. One of the most pressing issues surrounding hormonal birth control is the lack of comprehensive informed consent. Women are often not fully informed about the range of side effects associated with synthetic estrogen. The benefits of birth control, effective pregnancy prevention, lighter periods, and improved acne are typically highlighted, while the severe, albeit less common, risks are minimized. This information gap leaves many young women vulnerable. Unlike medications that are prescribed for acute conditions, hormonal contraceptives are often used for years, sometimes decades, with little reevaluation of their long-term impact on health. Dr. Sarah Hill, a researcher and author specializing in women's health, emphasizes the need for a broader discussion. Women deserve to know the full story. This isn't about scaring anyone away from birth control. It's about empowering them to make choices that align with their health priorities. There are alternatives to traditional hormonal methods that come with fewer risks. Non-hormonal IUDs, barrier methods, fertility awareness-based methods, and newer, low-estrogen contraceptive options are all viable for those concerned about their risk profile. But making an informed decision requires a balanced presentation of both the benefits and potential dangers, something that has been sorely lacking in the dialogue between healthcare providers and patients. The story of synthetic estrogen and its impact on women's health is still unfolding. As more research comes to light, the hope is that we can shift towards safer, more personalized approaches to contraception. The healthcare community must prioritize transparency, better screening for risk factors, and honest conversations about the potential side effects of hormonal contraceptives. For women, understanding these risks is the first step in advocating for their health. If you or someone you know is using birth control and experiencing unusual symptoms, a discussion with a healthcare provider is essential. It's also crucial for future generations of women to have access to safer contraceptive options that don't compromise their overall well-being. Your experience highlights a broader issue: the need for a healthcare system that prioritizes informed choices, research-driven recommendations, and above all, the safety and health of women at every stage of their lives. The hidden risks of hormonal birth control, especially those containing synthetic estrogen, are a serious public health issue that needs more attention. From the increased risk of strokes and blood clots to long-term effects on thyroid health, it's clear that women deserve to have all the facts when making decisions about their bodies. Don't forget to like, subscribe, and hit the notification bell for more videos on health, wellness, and thank you for watching.